really stress tests and provocation tests. So stress test is looking at stability, and the provocation looks for reproduction of pain. So these have been around in this system for decades, and they're very effective. I know there is the Laslett tests, but it didn't sound very good when we had our faculty meeting. They said that a study reviewing that would be fairly consistent in terms of being negative. In other words, it could rule out the fact there's an inflammation, but it wasn't always consistent when it came to the positive side of the test. So we didn't see any reason to change. We've kept on with the same tests that we have always used. So looking at them, the one we would do in the scan, which I'm sure you saw on Comp 1, we're looking at what was called the gapping test. And that was the name used by James Syriacs. But when you look at that in a cadaver, you're actually distracting the front of the joint. So it's a very good test for picking up pain, and is one of the most consistent tests for picking up ankylosing spondylitis in the active phases. So we do that. And the one thing to avoid, especially because we're dealing with chronic lumbar situation, don't push down so much as push across like this. Then we're looking at the rotational test. Remember, this whole mechanism is designed to be a massive spring. So we should be able to sense that. So I'm going to have my left hand pushing down on the left ASIS, my right hand pushing up. And this really refers back to what I was saying earlier. As I'm pushing down and anteriorly rotating this anomaly, if you watch her foot, you'll notice it tends to move downwards. The leg is getting longer. And then I would simply switch over and do the opposite test. Once again, try and emphasize movement parallel to the bed, not into the bed. A test you might want to do, just lost his name now.
Stoddard.
Stoddard's test, yeah, thank you. I'm going to place my fingers just inside the PSIS, literally to feel for any movement. I'm going to lock up the hip into flexion, internal rotation, and then I'm pushing straight down through the femur, which is pure distraction of the SI joint. So again, that's going to be a very effective stretch of the entire capsule. Let's get you lying on your side facing that way for me. So this one again, introduced by James Syriacs. He called it the compression test now, because he looks at closing the pelvis, so he's imagined that it will be compression. In fact, the posterior interosseous ligament of the SI joint is one of the thickest in the body. We're not going to get it with this test, but we keep it in place, especially in the scan, because it distorts the pelvis very effectively. It's only on one side. She's resting on her greater trochanter on her left side, so none of that torsion is going to go through there. We place the pad of our flexor mass, and then we're going to push through the ASIS on the lateral side straight down to the bed. And basically, that's a provocative test, so you can't feel movement through that because the pelvis is too springy. Let's get you on your tummy. The vertical tests, which again would be very important if we're dealing with the partum group, especially the postpartum group that might have been traumatized. We are going to fix the top of the iliac crest, and then we're going to take the apex of the sacrum and literally push it upwards. That is, of course, a relative inferior glide. And then we'll find the ischial tuberosity, place our other hand over the base of the sacrum, fix the tuberosity and try and push the sacrum inferiorly. And in a lot of instances, especially the upslip, but we will look at that later, that's quite an unusual injury, it does occur, that would be positive for pain, almost certain. And normally that occurs from damage in postpartum situations, landing on their butt, not having any treatment for it, and eventually it begins to break down. So those are the tests we use. You guys got any other tests that you use? No. Okay, as I said, we're aware of the Laslett system, but I don't think it adds anything to what we're already doing here. And I think some of the stuff with the legs over the bed and that kind of thing, that can be a little uncomfortable for some of the people we deal with. Okay, so let's practice the climbing test, and I would suggest using one of the lower beds, and then do the stress test. Let's get that far.